Hi, my name is Aoife Dooley and I'm a clinical specialist occupational therapist in neurosurgery. I work with people who have had surgery for the management of a brain tumour. Occupational therapy addresses the motor, cognitive and psychosocial needs of people with brain tumours. It is common for individuals with brain tumours to present with cognitive dysfunction. The causes are complex and can depend on the tumour's type, size, location and associated edema, as well as involvement of specific neural pathways. For example, a tumour in the frontal lobe may lead to changes in personality or behaviour and impairments in higher level cognitive functions like planning, organising, problem solving and working memory. A tumour in the temporal lobe may affect memory, language comprehension, sensory processing and emotional regulation, whilst a tumour in the parietal lobe may cause sensory issues, difficulty with language, mathematical and spatial challenges and issues with recognising people and objects. Understanding the tumour location as well as the pathology and treatment interventions to date will be very important to guide your assessments and interventions with this population. When working with people who have had a brain tumour, it is essential to carry out a comprehensive neurological assessment. This should be an evaluation of motor function, looking at strength, muscle tone and also sensation, proprioception and fine and gross motor skills. You will also need to look at vision, cognition and perception. Many individuals may present with expressive and/or receptive language impairments, which can make standardised cognitive testing difficult or inappropriate. In these cases, a functional assessment is key to understanding their cognitive and perceptual deficits and safety when carrying out ADLs. If you notice any expressive or receptive difficulties, it is important to liaise with a speech and language therapist. When visual deficits are identified, either through formal screening, during functional tasks, or reported by the person or their family, it's important to educate and help the person understand how vision changes may impact daily activities, especially safety within the home and outdoors such as crossing roads. Compensatory and rehabilitative strategies should be provided and a referral to orthoptics may be needed for further assessment or support. It's also important to be aware of hidden symptoms such as mild cognitive impairment or fatigue. These may not be obvious but can significantly impact a person's function. Our role is to identify and address these problems. It is important to understand a patient's pathology and if the tumour is low or high grade. This helps to guide rehabilitation interventions and ensure it is appropriate for the person's needs and goals. Patients with high-grade brain tumours often experience changing symptoms and side effects over the course of their cancer journey. Both disease process and treatment can result in impaired cognition and fatigue. Because of this, they should be linked with community OT services for ongoing support at every stage of their diagnosis. It can be difficult and challenging when setting client-centred goals for these individuals when there is a lack of insight or understanding of the prognosis. When providing education, it is recommended it involves both the individual and their family or caregivers and to use clear and consistent communication. The occupational therapy approach for these patients includes maintaining safety and independence in daily activities, preventing further functional decline, supporting quality of life as the disease progresses. Collaboration with the individual, their family and the healthcare team is vital. By using a client-centred approach, we can set realistic goals that are meaningful to the patient, identify barriers affecting occupational performance, and adapt or improve function where possible. People living with low-grade brain tumours may have persistent neurological deficits, including weakness, vision or speech problems, cognitive changes, fatigue and psychological needs, and may require either inpatient or outpatient services for ongoing rehabilitation and support. It is very important that individuals are linked with services as some longer-term problems won't be evident at the acute stage of care. There is a key role in discharge planning and deciding the correct discharge pathway for the individual. We regularly refer to a number of national community services when a patient is being discharged from Beaumont Hospital. These include the NRH Vocational Service and ABI Step Ahead if the person is hoping to return to employment. ABI Ireland and Headway for ongoing support and neuro rehabilitation. Quest Brain Injury Service, which is based in Galway, Mayo and Roscommon. On With Life, who are associated with ABI Ireland, and they support families of people with brain injuries. Their local occupational therapy service, and the new national CNRT teams that are currently being developed. We also signpost patients to websites such as Headway, Brain Tumour Ireland and Brain Tumour Charity for further information and resources. A person's function needs to be monitored over time as symptoms in this population can fluctuate. Every person's journey with a brain tumour is different, and overall, our focus should be holistic and to enable participation in daily life, even as the person's condition changes.